thanks everyone very much for coming down here, especially on a rainy day. I'm really impressed where we have a full house again, even with the weather. I'm Howard Rosen, as Lisa said. One of the roles I have is Director of Education. So I helped to organize this meeting, and that's why I'm sort of acting as MC for today as well. Usually this talk that I'll be giving now is given by Dr. Miller, the director of our center. He would have loved to come today, but work-related things kept it so that he couldn't make it today. He really apologizes, but I'll try to say whatever he would say. And I think what Dr. Miller likes to do, and I think is valuable as a start, is just to kind of give a very big overview of sort of the progress of the center, what's been going on, and how the center has changed to reflect the needs of the field and the needs that we get to learn about from working with all of you. And I'll go into that a little bit. So you know, we're really here as a center for many purposes that all intertwine. So I think even though we spend a lot of time doing research, our chief focus is on patient care. And most of our research is directly oriented to that. It involves participation of all of you and many others who didn't make it today, with the goal that we can diagnose and treat neurodegenerative diseases better soon and in the future. And at the same time, you know, we're doing this research that we'll be talking about today. And the last piece of that is education. So we have, you know, quite a large program to educate people from all levels, medical students in the professional scheme, nursing students, and then you know, postdoctoral people, and in many disciplines, social work, nursing, psychology, etc. And I suspect that many of you know exactly what I'm talking about, because many of the people that you've interacted with over the years have been trainees of that nature, and you've contributed to their training. So everything that we'll be talking about today reflects kind of integrated and advancement of all these kinds of issues. And because of our real desire to do as much as we can in these areas, our center's grown quite a bit over the last 17 years, or 18 years since it started in 1998. We're now up to about 200 employees. Dr. Miller would say we started at about, I don't know, 7, 6, 4. Dr. Kramer was one of those first 4. And we have faculty, as you see, from many different areas of interest that pertain to this field. Our clinic, where we see patients fee-for-service as part of normal clinical care, has grown quite substantially. We're seeing more than 10,000 patients a year now, both new and follow-up patients. We have more than 70 different research protocols, and many of the funds that support us are actually specifically oriented toward training. And I'll talk about one of those at the end of my talk. And as I've said, you know, as I've alluded to here, if you count it up, we easily see 200 trainees a year that come through our center to spend anywhere from a few days to, you know, years at our center honing their craft and learning about dementia. And because of, you know, our work, of course, but also I have to acknowledge that UCSF is a wonderful place to accomplish research. And the neurology department is a tremendous resource for you, for us, and I think that funding agencies recognize that and have really been very generous with the neurology department here, and that's what's allowed us to do all of that. I'll acknowledge some of those things in my next few slides, but you know, that's sort of the background. And you know, obviously, I can't talk about all those 70 research protocols and many grants that support it, but what I wanted to do is just focus on just a few that I think are particularly prominent because they represent kind of new extensions of the old work we've done in new directions. So one of them is work on frontotemporal degeneration. Many people, this is a kind of neurodegenerative disease that is not Alzheimer's disease. The symptoms are different. It's a disorder that we at the Memory and Aging Center are particularly well known for studying. And one of the problems is it's very hard to recognize in the early stages. And another aspect of it is that about 10 to 20% of the time, it can be due to a mutation, an abnormality in the gene that puts people at very, very high risk to get it. So that's actually, a problem, needless to say, for those families, but it's also an opportunity, because now if we can identify somebody who's at risk for this kind of disorder, we can start to see them earlier before they get symptoms and try to understand what the earliest symptoms are. And so that work is not only relevant for families who are affected by these mutations, but anybody who's facing neurodegenerative disease, because what's happening early in those families really is a reflection of what's probably happening in anybody who's starting to develop a degenerative disease. So that's a project that's really just started in the last couple of years. It involves collaborations with 14 other centers around the country who are interested in FTLD, and I think it's been going really well. Another study that I think has really blossomed in the last couple of years, and you've heard about it in a couple of these in the past, is the care ecosystem. So our center, I think, has best been known for diagnosis. We've thought a lot about how to improve diagnosis, how to make sure the diagnosis is accurate. And I think in terms of care, we know how to give it, and we've been very involved in care, but we haven't done a lot of research in care until recently. And this care ecosystem really represents one of our major pushes to start to help with care as well. So this is funded by the Center for Medicare Services, which is supposed to be on this slide, Center for Medicare and Medicaid Services. It's really a way to try to understand how can we coordinate care for patients and their families who are facing neurodegenerative disease in the medical system that, as I'm sure you all know, is very fragmented, and I don't think provides the best care in that way. And I see this project as a way to try to compensate for that fragmentation. And that's been going really well. We have over 250 enrollees, I believe, right now. A third project that I'll highlight is Dr. Rabinovici's project. Gil is here, and I don't know if he'll be talking about this very much. It wasn't what we assigned him, so that's okay. But as we've talked about in the past, there's a new tool we have called amyloid imaging, and it's a way to see the molecules that cause Alzheimer's disease, so that in the brain and using PET scanning, and so it can tell us whether somebody's dementia is due to Alzheimer's, or whether they might be at risk for Alzheimer's, or whether they're developing Alzheimer's. So it's pretty new still, and I think whereas researchers really understand how to use it, I think, and what it means in the community as a whole of medical, of neurologists, psychiatrists, primary care, there's still a lot of lack of clarity about the role of this technique in care. And so Dr. Rabinovici worked with CMS again and the Alzheimer's Association to get this quite large study that will support the scanning of, is this number right, 18,000 amyloid scans over the next few years, so that we can understand how are physicians using it in the community, and then figure out how our government, the Medicare, Medicaid, and other insurance should support its use. We've got another approach with Quest Diagnostics. So I think the logic around this is much the same, but in a different way. Again, I think, obviously we consider ourselves experts, even though we're not always right. We certainly know a lot about the area that we study, but we can't see every patient in the world. And we certainly know that many community physicians have a tougher time diagnosing cognitive disorders, understanding how to assess them, and getting people to the right places. And this Quest Diagnostics is part of a collaboration between, I bet you half of you at least know what Quest Diagnostics is. It's where we all get our blood drawn, if that's what our insurance happens to have a contract with. And they're a huge company that supports blood testing and other kinds of diagnostics, genetics, all kinds of things. And they've partnered with UCSF to try to strategically improve healthcare in certain areas. Cancer is one, and aging and neurodegenerative disease is another one. So we're trying to develop new techniques and tools to port out to community physicians to help them sort through the information they're getting, pick the right tests, and then come to a diagnosis more quickly. And the last thing I want to say, which is probably the biggest news, and it's only in the last year, is the funding of this thing called the Global Brain Health Institute. GBHI was really, it's a collaboration between UCSF and Trinity College Dublin. It was funded by, and we're very grateful to Atlantic Philanthropies for doing this. It was funded in order to establish this partnership to really improve brain health at a global scale. And I think the Atlantic Philanthropy folks, they wanted to leave what they're calling a legacy program, a program that would have, impact on brain health throughout the world for many generations. And the best way we could think of to establish a legacy is through trainees. And so the grant really focuses on training people kind of at the later stages of their training, when they're kind of almost done with that. And we're really trying to choose people that have a vision to make a lot of change in the US, but also in other parts of the world, to prevent and treat brain diseases that affect cognition in particular. And so the goal is going to be to train more than 500 people over the next 15 years that will, sort of go out and take this mission to the rest of the world and help us to learn how to do our work better also. And I think that represents a great opportunity. So, through all this, we've grown quite a bit. This is from our retreat in 2015. This is most of those 200 people that we talked about. And you've met many of them, and I have to use this as a way to say thank you to all of our research coordinators and administrators who kind of get this work done with us and you. But I want to point out that this event is more about you in the sense that it's why we're having it today. So people always ask me or us, what are my results and what are you learning from these things? And it's often difficult to say to somebody sitting in the office, your result is this and we're learning that, because the answers accumulate over time. And this is our way to try to say, well, here's a little bit of feedback to you about some of the things that you were involved in over the years and what they're producing, as well as a way to update you on what's going on in the field that hopefully you're interested in. That actually, I don't think any of these people are people in the audience. I'm pretty sure. I didn't want to embarrass anybody by actually, putting you guys up there. But the point is just to say, thank you to all of you. And I hope this event really serves the purpose that we want, is to show our appreciation to you and hopefully give you a little feedback that makes you feel better or continue to feel good, hopefully, about participating with us. Last few things, some announcements. There are glossary sheets on your tables to help with some terminology that we will try to avoid, but if we don't, you can at least double check what it means. We have these feedback forms. Everything we do tries to reflect your feedback. We read through all of it. This being an hour later than it was last year is one element, for instance, where we said people complained it was a bit too early, so it's an hour later. We have these question cards, which, many people have the same kinds of questions, so if you could make sure to check off the category, it'll help us organize them so that we can take one or two that represents a category. And lastly, I want to remind people that these events are videotaped, although not this year. Yeah, there we are. Sorry, sometimes they're over here. So these events are videotaped, and within a few weeks, couple of months, they get uploaded onto our YouTube channel, and so that if you want to review things or if you want to pass them on to friends or colleagues that because you think they'd be interested, please do. This is just the kind of top bar of our website, and you can get on our YouTube channel, by clicking on the icon, or you can go directly to it. And the last thing I want to say is thanks to all of our research coordinators again, but particularly to Lisa Critikas, who organized this lecture. Stand up again, Lisa. I really want to say thank you. And Ken Edwards, who many of you met and who's here somewhere. Where's Ken? He's outside. But Ken Edwards, I'll tell him you applauded. And the whole UCSF ADRC team and the whole UCSF Memory and Aging Center team that was supposed to be. So thanks.